first were surgeries. So the next surgery we'll be talking about is what is known as a surgical valvotomy. Surgical valvotomy. So for the surgical valvotomy, we said that it's just a procedure to relieve narrowing. That's if heart valves are narrowed, stenosis. So blood is finding it difficult to pass through the heart valve to the down chamber, or if it is a heart valve in the pulmonary trunk, aortic trunk, and all of that. Okay, but there's narrowing, so you want to relieve that narrowing. So most commonly, the valve that is usually affected by stenosis is mitral valve. So it's a surgical technique to treat valve stenosis. Sorry, let me get a pillow to support my back coming. Okay, so it's a surgical technique to treat valve stenosis, okay, by cutting, separating, or removing the obstructive tissue from the valve. Goal is to now improve blood flow across the valve, you understand. Also reduce the pressure buildup, reduce generally all those signs and symptoms that the valve stenosis was bringing, you know. So the valves treated is most commonly valve that is affected by stenosis, mitral valve, followed by aortic valve, and the pulmonary valve, okay, usually affected by stenosis. So types of valvotomy, we have the commissurotomy. So incisions are made at the commissures. This is where the valve leaflets meet, okay, just to separate the fused leaflets. So it could be that it's the leaflets that are fusing, so you make an incision between to separate them again. We have the decalcification. Sometimes it could be that valves are actually getting narrowed because there's deposition of calcium in them. Then we have the balloon valvotomy. This one, a catheter with balloon will now be put between the valve that is actually stenosing, and this will help to open it up again. So indications, when will you actually want to do these valve surgeries? When there's mitral valve stenosis, mostly due to rheumatic heart disease, okay, and there's congenital valve stenosis in newborns and children, and most of the times when the patient is showing symptoms of like shortness of breath, fatigue, or swelling due to restricted blood flow. Okay, so that's what we have for what a surgical valvotomy is.